The United States touts the best healthcare in the world. And as an industrialized nation, it's also touts itself as the most expensive, and our outcomes are the worst. So how do we reconcile that? And what you realize is that we don't prioritize moms and babies. We don't prioritize their outcomes. Infant mortality is on the rise in the last year, which is absolutely discouraging and disappointing. 5.6 infant deaths per 1,000 live births, and that rate was higher than it was in 21. 2 of the 10 leading causes of death or mortality rates were increased cases of maternal complications and bacterial sepsis. We have maternity care deserts across our country where we don't have access, and we have hospitals closing more so than ever, and counties where women are driving further and further for their care. So I start to think, is there more here to that as hospitals are closing? So factors that affect the maternal outcomes are absolutely race. We've seen that for Black and Brown, Native American, Indigenous people. Those outcomes are the worst, whether it is infant death, whether it is inadequate prenatal care, obstetrical outcomes. We've seen that. Your geography, your race, and your wealth should not matter for your outcome. And it does. The health of our families really tells you the health of the nation. Moms make the decisions of most family healthcare decisions. I think it's like 80% is the data on that. And if that's the case, we need to make sure that we're prioritizing them within the healthcare system. I also start thinking about the disparities, and health equity is something that we continue to champion, and realize that if we could solve this for Black and Brown families, we could solve for all families.